Oh, hello fellow campers and canoe trippers. As you can see, we're not up in the boundary waters, and we're not downstairs in the canoe corner. We're in my den that I changed into a place where I can lay down and recover from my total knee replacement. Now, about a month ago, I went to the Veterans Hospital in Minneapolis and had that operation. For the past couple years, I've had a lot of pain in this knee, and on the last two canoe trips, I had a lot of problems getting over the portages. So despite the injections I had and the medications I was taking, I decided it was time to get the TKA, the total knee replacement. Now, I chose to go to the Veterans Hospital, even though I have private insurance. I used to work at the Veterans Hospital, and I know my way around. And the orthopedics department at the Veterans Hospital in Minneapolis has a very, very good reputation. The surgeon who did my knee, he had done 3,000 knee replacements. He was also an outside doctor that was brought in to do knee replacements. He was voted the best orthopedic surgeon in Minneapolis back in 2008. Okay? Well, they really gave me everything I needed besides the new knee. They started me out with lots of information, everything I needed to know about what was going to happen to me. Then they sent me home with a whole pile of equipment. A walker, a chair to go into my bathtub. I also gave me a big long shower head on a hose so I could sit down and shower myself off. They also gave me a raised toilet seat and a frame to go around the toilet so I could lift myself up, which is very necessary because you're not going to be able to bend your knee at all. And of course they give you a big bag of goodies. Take them home and use them. You're going to find things like handy wipes, toothpaste, stick deodorant. One of the best things, the most handy thing they gave me, was this gizmo for putting your socks on. You put the sock over this plastic frame. You attach the sock to it with a couple of these little straps, and then you can put it over your foot and pull your sock on. Now, I'll have to say I never used it because I didn't get out of my bathrobe and put socks on for probably about 2 weeks, and by then I could move my leg around enough to be able to do that. Some of the other things they sent me home with is a sponge on a stick, getting cleaned up, what they call a reacher. This comes really in handy, especially for moving blankets around in the evening. They get them pulled up around myself. They give you a stick with a couple little hooks on the end. That came really in handy too for just pulling objects over toward me while I was laying in bed. Also got a big shoehorn. That really comes in handy because you're not going to be able to bend. That's why they give you all these long gizmos. One of the best things they gave me was this. That's called the invisible dog. You put it around your foot, and then you can move your foot around to get it up onto the bed and down, because once again, you're not going to want to bend your leg. They even gave me a plastic sheet to put under me, so when I was laying in bed doing exercises, I could squirm around on it and not be stuck to the sheet. The best thing that the Veterans Hospital gave me was this. It is basically an ice bucket with a motor in it, a hose, and a big pad. You can see the all the little rivulets running through it to circulate water. Put that over my knee and it pumps ice cold water onto that swollen, and it will be swollen, very painful knee. I have been using this over the past week or so, even though I'm a month and a week out of surgery, because still, when I walk around, I still have to use my cane sometimes. And if I go for a drive and I go shopping to get groceries and I come back, that knee hurts, and I don't want to take a lot of medication for it, I'll put this on, and it really helps. One of the other things they're going to send you home with is one of these things called challenge breathers. The idea is that when you're in surgery, you're going to be intubated, and your whole body is basically going to go to sleep, and your lungs have a danger of filling up with fluid, so they want you to exercise your lungs as well as the rest of your body. Before you go in for your surgery, they'll give you scrubs like this to scrub your whole body. When you get into the operating room, they will scrub your knee and your leg very thoroughly, but that's just to get you started. Now, when I went over to the hospital, I thought, I think I'll take over some of my own personal things. So I took over a bathrobe, and I took over some of these, what would you call them, what the heck do they call them? Sleepwear, with dogs on it that my wife gave me for Christmas. And I thought, well, I'll put those on. Forget it. When you're in the hospital, you're not going to want to feel like doing anything. When you come out of the operating room and they put you into bed, you're going to be there. You're going to have an IV in your wrist where they're going to be putting morphine and antibiotics. You're not going to feel like reading. You really won't feel like eating much. I took over a little tape player and some headphones, and I just kind of drifted off listening to that on a lot of drugs. They're also going to send you home with a lot of drugs. Pain medication, stool softener, and you better take this or you will be very, very unhappy. Tylenol, for those days when the pain's not so bad, and very importantly, aspirin. You need to take a couple aspirin every day to help thin your blood, because the big danger in knee surgery is clots. They don't want you to get any blood clots. Now, what you've seen, what I've done with the room, is I put in a spare bed, lots of nice pillows to lay back against. I have my computer in here, and sometimes I watched it, but a lot of times I just listen to music. I brought in a big camping jug full of water, so I could make up my own powdered drinks instead of having my wife run in here all the time to do that. I also brought in a few sort of snack things that I like, and some nibbles while I'm in here. They'll also give you a little bottle of lotion. You're going to find your skin is going to be very tight and swollen and dry. If you rub that lotion in, it will really make things seem an awful lot better. Now, I brought in different books and magazines to look at when I came home. For 2 weeks, I didn't look at a single one. I just took pain medication, fiddled on the computer a little bit, and listened to music. It wasn't until probably a week and a half, maybe 2 weeks later, that I was even able to pay any attention to what I was doing. Getting up and going to the bathroom, I had to use the walker. Now, about some of these things that they send home. Practice using them before you actually do it for real. They sent me home with all the stuff about a week before my surgery. So I took this into the bathroom. They also give you a handle that straps onto the side of the tub, and I practiced getting in and out of the tub several times to see which way I could move and how stiff my leg would be. Same with the walker. They show you how to use one of these in the hospital, but there is a trick to using one. You have to stand up straight and not lean over on it. Urinals, make sure you keep it handy, and if I were you, I would practice using it once or twice before you have to do it when you come home from the hospital. It's really awkward. The same with the raised toilet seat and the frame around the toilet. Try that out once so you're not doing it for the first time with a really painful stiff leg. So that's about it. As you can see, I'm still down here after a month. I tried sleeping upstairs last weekend with my wife, but my legs still hurt too much. I stayed awake, and then she likes to roll over and hug me, and she rolls right over on my leg. So anyway, I kind of hope to get out of here and by this weekend. Today I'm taking all the rest of the stuff that I don't use downstairs and put it away. So there it is. There are some other good videos on YouTube that talk about a knee operation. There's one that shows you the entire operation, the whole hour and a half of it. I watched it. I kind of fast forwarded through a couple bits, but when I went in to see the doctor, I said, you know, I watched the whole procedure on YouTube, and the resident who was working with me said, oh, well, I guess I won't have to explain much about how it works to you. And I said, you know, no, I know exactly what's going to happen to me. And that's important. Don't go in cold. Realize what they're going to do to you, how it's going to work, and that for at least 2 weeks you're going to be very unhappy and painful. The 2 weeks after that, you'll just be sore, and then you'll be able to start driving around after about a month. But take it easy. Don't push it. Walking around on hard floors in grocery stores, you'll feel it. It'll be uncomfortable. So there you are, fellow campers and canoe trippers. I am so enthusiastic about how this is going to work out that I got myself a permit for the Boundary Waters for the last week in August. So I figure by the last week in August I should be like new and back out on the water again. That's it. Thanks for watching.